My name is Matthew Surk, and we're going to be going over the Rocky Mountain Spotted Fever. What is Rocky Mountain Spotted Fever, or I'll refer to it as RMSF? Rocky Mountain Spotted Fever is a bacterial disease that's transmitted via bite by an infected tick. Some of the ticks that can transmit RMSF are the American dog tick, referred to as a Dermacentor variabilis, the Rocky Mountain wood tick, referred to as a Dermacentor andersoni, and the brown dog tick, referred to as a Rhipicephalus sanguinus. The American dog tick mainly resides in the Midwest to East Coast, while also remaining in parts of the West Coast, specifically California. The Rocky Mountain wood tick resides in the Rocky Mountain states, which include Wyoming, Colorado, Idaho, and other states. And the brown dog tick resides in southwestern United States and Mexico. However, it is found in all parts of the United States. Those are just areas that has highly condensed populations. So here we're going to see various figures showing where these different types of ticks mainly reside. Like I said, the American dog tick will reside in the West Coast, mainly parts of California, and from the Midwest on eastward and all the way to the East Coast. The brown dog tick resides anywhere in the US, but is very congested in areas around southwestern United States and Mexico. And then the Rocky Mountain wood tick will reside mainly around the Rocky Mountain states, which include Colorado, which is about right here, Wyoming, which is right above, and Idaho, which is a little bit westward. Concerning the causative agent of RMSF is the bacteria called Rickettsia rickettsii. Rickettsia are obligate intracellular gram-negative bacteria that are found in ticks, fleas, mites, chiggers, and are rarely found in mammals, but very rare cases. And Rickettsia are usually found in ticks, which is why we are going to be focusing on ticks. Rickettsia species typically include two antigenically defined groups that are related, but they differ in their surface-exposed proteins and lipopolysaccharide antigens. And these two groups are the spotted fever group and the typhus group. And although we are focusing on the spotted fever group, I'm going to mention that the scrub typhus rickettsia lack lipopolysaccharides, peptidoglycan, and a slime layer. Concerning Rickettsia rickettsii, they are typically smaller than most gram-negative bacilli. They are usually about 0.3 micrometers to 1 micrometer, and however, due to their size, Rickettsia rickettsii are not likely to be transmitted in the air, but are mostly transmitted via tick bites. Concerning the common signs and symptoms, we usually have fever, headache, rash, nausea, vomiting, stomach pain, muscle pain, and lack of appetite. In the most severe cases, we're going to have vomiting, stomach pain, and muscle pain. But in the most common cases, we usually start with a fever and then develop a headache and a rash. So, like I said, fever is the first symptom of RMSF. However, it is difficult to differentiate the cause until other symptoms present themselves, except these other symptoms are usually a rash. And a rash is the most common sign of RMSF. It typically occurs in the arms, hands, feet, and legs, and usually develops around 2 to 4 days after fever. And concerning the appearance of the rash, I'm going to refer to these two figures, in which we have red splotches as seen on this leg and a little bit right here, and then pinpoint looking dots as well. So you'll see very defined red dots all over the patient's rash. And just like right here, you see red splotches. There's one right there. There's a whole line right here, and then very distinct red dots. And I would like to note that rashes usually occur in 60 to 70% of patients, so it is a very common symptom concerning Rocky Mountain spotted fever. Concerning transmission, rickettsia enter through the skin via ticks, mites, or feces of infected ticks and mites. After entry, rickettsia spread through the bloodstream to infect the endothelium of blood vessels and vascular smooth muscle cells. However, it usually infects the endothelial cells of the blood vessels first. And once rickettsia reach those endothelial cells, replication is going to occur within the cytosol of the endothelial cells and damage cells directly via focal lysis. And I will go to the next slide to show these images a little bit better, in which we have an infected tick biting a person on the skin, and then having a transfer of bacteria from the tick into the blood vessel. Now, through the bloodstream, we're going to enter an endothelial cell via endocytosis. And then after getting into the cell, replication is going to occur via binary fission. And then after binary fission occurs, we're going to have lysis. This doesn't really show focal lysis, but it's just showing the spread of the bacteria from one endothelial cell into the next. There's a lot of information on the slide, but I'm going to try to break it down as simple as possible. And I'm going to be referring to this figure the most. So, concerning spotted fever group rickettsias, they spread via focal lysis, as seen right here, in which you have bacteria exiting endothelial cells. Rickettsia infect adjacent endothelial cells by traveling through the bloodstream and entering via local lesions, as seen right here. And then infected endothelial cells are going to secrete cytokines, chemokines, and prostaglandins to attract neutrophils, monocytes, natural killer cells, and T cells. However, infected neutrophils and monocytes are going to release nitric oxide and reactive oxygen species, which aid in the elimination of bacteria. Now, I do want to note that in the direct killing of infected cells, we're going to have lots of T cell activity and lots of natural killer cell activity, but neutrophil and monocyte secretion of nitric oxide and reactive oxygen species also aids in the killing of Rickettsia rickettsii. Now, concerning diagnosis, it is difficult to diagnose this disease quickly, as fever is the first symptom, and fever is seen in a lot of other diseases. But other tests can be administered to help with diagnosis. But first, we need to consider patient history. So, two questions need to be asked. Has the patient been bitten by a tick recently? And has the patient been in around brushy areas with tall grass that ticks like to latch onto, or in areas with high tick populations? And concerning blood tests, indirect immunofluorescent antibody assays, or IFA assays, are going to be done for immunoglobulin G, IgG. This is done using the R. rickettsii antigen, which is going to just make sure that the antigen is there. If the antigen is there, then it's going to determine that your patient does in fact have RMSF. PCR can also be done using DNA extracted from whole blood, specifically the endothelial cells that line the blood vessels. And then cultures and immunohistochemistry, IHC assays on skin biopsies. So the areas with rashes will be biopsied, and tests will be done in order to assure that this patient does in fact have RMSF. Concerning treatment, RMSF can be life-threatening if not treated. However, nowadays that we have access to antibiotics, we are able to treat this fairly early with the antibiotic dioxycycline, which is used to treat infection, and doxycycline is recommended for adults and children of all ages. So I have an image of the actual container in which the medicine is in. But I also wanted to include a structure for those in organic chemistry. This is a structure of doxycycline. And then let me move this. Over here, you're going to see a little infographic provided by the CDC describing the purpose of doxycycline and how to prevent tick bites and just preventative measures against Rocky Mountain spotted fever. Okay, let me move this back. Now, concerning preventative measures, there is currently no vaccine for RMSF, but there are preventative measures that can be taken. The first three are to prevent ticks on yourself, prevent ticks on your pets, which is very likely, in which pets can actually transfer ticks from themselves onto you, which is pretty common, and then preventing ticks in your yard. So before you go outside into grassy areas or forests, you can treat your clothing with products that contain 0.5% permethrin. And permethrin is a pesticide or insecticide that prevents insects from latching onto you. Permethrin can also remain on clothing for several washes, so it doesn't need to be applied every single time you go outside, and that would be a lot of times because everyone goes outside quite a bit. And if you don't have access to 0.5% permethrin, you can also use basic insect repellent. And then when coming back inside, you need to examine yourself in common areas which ticks can latch themselves onto. You should probably also check your pets for ticks to make sure that they don't spread ticks anywhere in your house. And also make sure to just shower just to wash the ticks off. Um, it's fairly common to shower. And then this image is just to show where specifically ticks are going to be found on you. A lot of times, if you have long hair, it's going to be found in your hair. It can also be found around the ears. Uh, this is a somewhat uncommon place to find ticks, but you can also find them under your arms. Inside the belly button is very rare because you will most likely be wearing clothes outside, but it can be found there. You can also examine around the waist, in between your legs, and on the back of your knees. And then, when concerning the historical fun facts of RMSF, um, there's a very obvious fact which I thought was a little funny considering that I live in Colorado. RMSF got its name from being originally discovered and rapidly spread throughout Rocky Mountain states. The disease was first discovered in 1896 in the Snake River Valley of Idaho. But it was first called black measles because due to no treatment for the actual disease, uh, patients would get very, very ill, and the skin would turn black if not treated, getting its name, black measles. And upon its discovery, RMSF was considered often fatal, killing hundreds of people in Idaho. And by the early 1900s, a couple years after it was actually discovered, it could be found in Washington, Montana, California, Arizona, and New Mexico. And that is all I have. Thanks for watching.